Okay, we're going to briefly go over the clinical tool that you're going to have in critical thinking. And on your critical thinking exam, it is actually your part 2 of your critical thinking exam. And it's going to be the tool that you're going to use throughout the year, only the levels will go up with each semester. This one's been abbreviated for the exam, so the clinical reasoning tool you'll use in clinical will look a little bit different, but not a whole lot. And it's basically because part of those components are comprised into the short part 1 essay quiz that you're going to take for critical thinking, okay? So let's see if we can get started. We are in Blackboard. We are in the practicum in yours. We need to look at this week. You've got your critical thinking folder. Open it up. And then you've got all kinds of good stuff in here. Everything has PowerPoints. It's also been audioed except for the clinical reasoning tool. And we are fixing to take care of that. And it looks like we took off the wrong thing. The case study should be here, so we need to fix that. I will go back and put the case study on for you guys, but I'm going to take this one off. We need this one. We don't need that one. Okay, I'll go back and put the case study on for you. For right now, we're just going to carry on. Alright, so down here, clinical reasoning tool. This is the tool that you will use to take your exam. I'll make sure it's loaded up in your exam portion. Open. Okay, so my case study starts out with a 13-year-old female high school student who was admitted to the hospital with complaints of shortness of breath and right-sided chest pain upon breathing. And you'll have this same one that you can look at and go through. So, she came in complaining of, she rates her pain at a 6. She's tearful, says it hurts to breathe. I feel like I need more air. She states she's been sick for the past 3 days. She has a history of asthma since 6, and she admits she smokes half-pack cigarettes a day. Her parents each smoke a pack a day, and each parent states that smoking has no effect upon their daughter's condition. So the parents admit to smoking up to 3 packs a day in the home, but they deny it has any effect on their child's asthma. She is currently receiving intravenous fluids, 800 milligrams of vancomycin IV every 12 hours. She has 10 intensive spirometer treatments per hour while she's awake, and chest physiotherapy. Her pulse ox reading is 92%, her heart rate's 90, her respiratory rate is 28 beats per minute, her blood pressure is 120/74. She's pale, but her skin is warm. Her capillary refill time is 3 seconds. She's urinating 400 cc's of clear urine each shift, so that's 12 hours, and maintains a normal bowel movement pattern. Wheezes are heard bilaterally. Complains of fatigue, muscle weakness. Cough produces small amount of white thick sputum, and sputum culture on admission confirms the diagnosis of streptococcal pneumonia. Plans are being made to discharge the patient to her home in 3 days. So, what's the history of her present illness? Well, patient admitted with complaints of shortness of breath, pain 6 out of 10, sorry about that, sick for 3 days, Now, I'm not putting my vital signs on here until I get further down where I have a place for vital signs. If I had a pulse ox reading up here that was bad, I would probably put that on there. But she's been admitted, and she's receiving all these other things after she's been admitted. She's fatigued, muscle weakness. You ever have a time when your fingers work faster than your brain, or vice versa? Muscle weakness and productive cough. Now, what's some of her psychosocial cultural past history things that we've got? Well, she's had asthma since she was 6 years old. That's pretty significant, isn't it? That's probably got something to do with what we've got going on here. She smokes. She smokes half pack a day. What else? Parents smoke. 3 packs a day in the house. And do not believe that it's now you see how these little things are expanding as I'm typing them in, so don't worry if it looks like you can't get all your stuff in there. It just expands. She's also only 13 years old, and I think that's significant. Okay. So, what's relevant from present? Well, she's having shortness of breath. This will be. She is pain. And she feels like needs more air. So what are the clinical significance that I think shortness of breath? Well, she may suffer from hypoxia. Need to check her pulse ox. Definitely affecting lungs. Need to monitor lung fields for crackles, possible pneumonia. And any other thing that you might feel like significant. She could be respiratory distress. That could lead to respiratory arrest. And things you want to do, monitor respiratory system, respirations. So these are things that, just because she's shortness of breath is, why is she short of breath? She's only 13 years old. She has asthma. Maybe she's having an asthma attack. Possible asthma attack. Crisis. Sounds more official. So I could go on and on forever. So what about her psychosocial thing? Well, she's had asthma since she was 6. She smokes and only 13 years old. Parents smoke in the house and believe it isn't harmful. So, what's my clinical significance to this? Well, asthmatic patients have compromised lung fields. Therefore, she should not be smoking. Her lung fields to become more compromised. She needs teaching on smoking cessation. At her age, her parents should be more involved in her care. Parents need education on harmful effects of smoking, especially, I'm just making this up off the top of my head, guys. Y'all gonna have to put a little bit more research into it. Especially with compromised lungs. This could lead to early COPD, cancer, etc. Okay, so what did we do diagnostic procedure wise? Well, we did a chest x-ray. What else did we do? Well, that's the only really diagnostic procedure that we did, because we did do some labs on further on. The results of our chest x-ray, infiltrates in the lung. And it's not asking me to tell anything else. So lab. Now, you'll notice that there's already some lab put in here for you. Glucose, urinalysis, and all these things. But I don't see anything on here that we did as far as that goes. So what did we do for lab? We did a sputum. Sputum culture. And basically that's about it. We did not order any CBC or hematocrit or anything like that. So, basically, the results of my sputum culture, it was emitting, and the results was that it was, actually I think our sputum culture should go up here because we are looking for a specific result rather than a running level. The results of that culture was confirms diagnosis of streptococcal pneumonia. Okay, And we really didn't have any other labs, so I don't have to do anything about labs. We didn't do an ABG on her, which we should have. If she came in with shortness of breath, history of asthma, I think that we have, should have done that, but we didn't. So what lab results were relevant? Well, our sputum was relevant because it targeted and we don't really know if the sputums and we won't usually take another one. So usually this would go more like if your hemoglobin was 33 and then the next time it was taken it was 27, then we know that it's worsening, and that's what that means there. Our current vital signs, we'll type those in. Basically, for someone who came in with pneumonia, we are missing a temperature here, so that's not good, is it? So her pulse was 90. Her respiratory rate was 28. And her blood pressure was 120/74. So our O2 sat was 92%. And this was, when you're writing in O2 sats, be sure that you're saying whether it's on room air and hers was on room air. Then Wilda over here is pains. Pain, she's says it really hurts to breathe. And rates, of course, rates goes down, and it really hurts to breathe. I feel like I need more air. And then on intensity, she rated it a 6 out of 10. Her location, she right side chest pain. Duration of her pain is when she breathes in. Well, let's say constant, pardon me, because it hurts when she breathes in, it hurts when she breathes out. Since it's constant, nothing actually aggravates it or relieves it. So then on down here we got general appearance. Her skin is pale. Sorry about that. Warm. Respiratory 28 breaths per minute. Painful. We hear wheezes bilaterally in lower lobes. Cardiac, heart rate regular, rhythm. Neuro, cat refill is less than 3 seconds. So you get the idea. Her skin, of course, is warm, pale. Her general appearance, distressed, anxious. So get that. So then you're going to go down here and say, what did you have up here that's relevant? Well, she feels like she can't, like she needs air. 6 out of 10. Pale. All these things are abnormal. Rest of them are normal. So clinical significance of that. Well, with air hunger, there is lung compromise. Possible blockage of the area. Etc. So that's clinical significance. So that clinical significance, we need to monitor pulse ox, breath sounds, provide fluids to loosen secretions, etc. Y'all can't write etc. But I guess since I don't want y'all writing it, I better not write it. And then down through here, did you do any of this? If you didn't do any of these things, you don't have to address them. Pharmacology, medications only if given. She's taken vancomycin. And classification and dosage, is it high or normal? So this is what she's taken. So her dosage is 800 milligrams every 12 hours. So that's an average dose. Then give me the mechanism. You'll have to look this drug up. Give me the mechanism. Now you will be allowed to use your diagnostic book in your laboratory book. So this will tell you. So is there anything we need to know about this one? It's a very toxic drug. Need to monitor levels. Watch for adverse effects and whatever those are. So, and then if she's taking anything at home, which we don't have it given here, but your scenario may very well do that. Now, when we're given medication calculations, this has got to do with your IVs. So she's getting an IV medication, or if she's getting an IV fluids, it goes here, and you have to do your hourly rate for that IV piggyback. Like if she's getting 800 milligrams IV piggyback every so often, every 12 hours, then you need to know how fast you need to run that 800 milligrams, and you have to know how many milliliters is in there. So as you can see, this little case study is a little bit short on information because we are trying to just give you an indication on how to do that. So is there any relationship of past medical history and current medication? Well, her past medical history of asthma and the current medication she's on, which the only current medication we have her on is the vancomycin, has been related to her having pneumonia. So her past medical history would be all of that information that led us to believe that she has pneumonia and what we're giving her for that. So what priority problem is she presenting with? Well, pneumonia is a medical diagnosis, so you're going to have to come up with something more like altered gas exchange or altered ineffective breathing pattern is probably more specific for her because there's no ABGs, and without ABGs we shouldn't use gas exchange. What's the pathophysiology of our pneumonia? You must include your references and what primary nursing diagnosis is going to guide that care. And we're not going to put in the interventions and stuff because you won't have time to do those. So you'll want to save this and then upload it just like you would an assignment. So basically this is your clinical reasoning tool. and very briefly, very sketchy, filled it out very hastily. You will be spending a lot more time with that in the clinical setting. But I don't expect you to do a whole lot of anything with that. So I will put this case study up for you guys, but I've got to go ahead and see if I can get this to save, and let's see if it will.